How can you understand your calcitonin blood test results? Imagine sitting in your doctor's office and hearing that your blood test results show your calcitonin levels. What does that really mean for your thyroid health? Let's break it down. The calcitonin blood test measures the amount of this hormone in your blood. Calcitonin is made by special cells in your thyroid called C cells. Its main job is to help regulate calcium levels in your body. When your levels are normal, it usually means your thyroid and calcium balance are doing fine. Normal levels are typically low or indetectable in healthy individuals. Having low calcitonin doesn't usually cause symptoms or health issues because other hormones like parathyroid hormone help keep calcium balanced. If your test shows elevated calcitonin levels, that can be a sign that something is going on with your thyroid. High levels often point to conditions like C-cell hyperplasia, which is an increase in the number of C cells, or medullary thyroid cancer. When calcitonin levels are very high, say more than 20 times the upper limit of normal, it's a strong indicator that these conditions might be present. But remember, a high calcitonin level alone isn't enough to diagnose cancer. Your doctor will likely recommend additional tests, such as ultrasound scans, biopsies, or imaging studies, to get a clearer picture. In cases of medullary thyroid cancer, calcitonin levels are usually elevated, especially in sporadic cases. However, in about 30% of patients with familial medullary thyroid cancer or multiple endocrine neoplasia type 2, calcitonin levels can still be normal even if cancer is present. After treatment, usually surgery to remove the thyroid, calcitonin levels should drop to very low or indetectable levels. If they remain as high or start to rise again, it could mean the cancer has come back or there is residual disease, and your doctor will want to investigate further. It's also important to know that certain factors can influence calcitonin levels. Medications like epinephrine, glucagon, or oral contraceptives, as well as physiological states such as pregnancy or being a newborn, can cause levels to rise temporarily. Laboratory factors, including interference from antibodies or differences in testing methods, can also affect results. That's why healthcare professionals interpret these results carefully, considering your overall health and other test findings. Your calcitonin test is often used alongside other blood tests, such as carcinoembryonic antigen levels, calcium levels, and thyroid hormone tests. Imaging studies like ultrasound or scans can help locate any tumors or abnormalities. If your levels are elevated, your doctor will likely recommend further testing to determine the cause. If you've already been treated for medullary thyroid cancer, regular calcitonin testing helps monitor for any signs of recurrence. Remember, normal calcitonin levels do not completely rule out medullary thyroid cancer, especially in cases with a family history. Each person's situation is unique, and interpretation of your results depends on your medical history, symptoms, and additional tests. Always discuss your results with your healthcare provider, who can give you personalized advice based on your overall health. Understanding your calcitonin blood test results is about seeing the bigger picture, your entire thyroid health and risk factors, so you can work with your doctor to stay informed and proactive about your well-being.